Thank you, Mr. Speaker. Members, I want to first thank Chairman Bonin and all of the Appropriations Subcommittee chairs and conferees who worked so hard on this and have done a great job explaining, summarizing this bill before us this afternoon. So a week ago, I wasn't sure how I was going to vote today on Senate Bill 1. There were a lot of questions I had, and I know a number of members of the body had, particularly members of the Democratic caucus had, about this bill and where it ended up. So I want to talk for a minute why I will ultimately vote for this budget, but I'm going to talk some about what I don't like in the bill first, and then I'll tell you what some of the things are that are really, really good. But I think I speak for a lot of the Democratic members here, as chair of this caucus, that there's some things there that have to be acknowledged about the budget. First off, let's talk about Winter Storm Uri. That affected virtually every one of our constituents in this state. And there is no direct assistance to our constituents to help recover from the financial burden of that storm, and no funds for weatherization, for demand response, and the other excellent policies that members have put forward on this floor in different bills throughout the session, which many of which are languishing on the other side of the building right now. We would have liked to have seen that. On health care, it's no secret that our caucus has been unified for years in our advocacy for expanding Medicaid, expanding health care access under the Affordable Care Act to ensure more than 1.5 million Texans working families who, if they lived in one of 38 other states, would have health insurance, but because they live in Texas, they don't. And we had an opportunity on this floor when we debated Senate Bill 1 on the House side to adopt Chairman Coleman's amendment, which was not Medicaid expansion, was simply a flexibility rider that would have given Governor Abbott complete control of how he wanted to do it, but to maximize federal funding in order to reduce the number of uninsured in the state. Unfortunately, that amendment did not pass, and it's regrettable it's not in this budget or something similar. We had an extensive meeting this morning talking about the budget, and it has to be noted that our historically black colleges and universities are underserved and continue to be. And that is an issue that we must address as a legislature whenever we come back and we have federal funds to work with to address the inequities at our HBCUs. In addition, as Chairman Anchia and Mr. Martinez-Fisher laid out, we've got a lot of money for so-called border security in this bill, $1.1 billion. It's a lot. A lot of us would argue it's too much for reasons that have already been articulated. $50 million for alternatives to abortion, a program that many of us deeply believe does little to no good for the people of this state. But there is a lot to like and to be proud of in this budget, and that's why I'll vote for it. So, first off, it's very clear in this budget that the legislature retains and asserts our authority when it comes to appropriating dollars. And so when those federal funds are available, it is this legislature that will appropriate them, as it should be. And that is a bipartisan message that this House has made clear now for the last couple of months. In addition, looking at Child Protective Services, where our state has had so many challenges over the years, the conference committee report maintains the House funding levels for CPS caseworkers that are necessary to meet the court-mandated caseload guidelines, so we can finally, hopefully, begin to fix what has been so wrong in CPS for so long. The budget conference committee report adopts House funding level for ECI to address caseload growth to the tune of $339 million, significantly higher than what was passed in the Senate. The House rider for minimum funding levels for rape crisis centers and sexual assault nurse examiner programs is maintained, and that's a huge accomplishment. The budget funds House Bill 133 by Representative Rose to extend Medicaid coverage for new moms, to begin to address our horrific maternal mortality situation in Texas. And I know Representative Rose is going to be working hard over the next 4 days to bring that home. This budget limits amounts paid by the Office of Attorney General for outside legal contracts, something a lot of us have been concerned about for a long time. That's a needed accountability measure. I'm glad that that's in here. And solid funding for Texas Parks and Wildlife, so these facilities that all of our families, regardless of their zip code, regardless of their income level, can enjoy. But the biggest win, I think, in this budget is on education. It fully funds House Bill 3, the landmark school finance reform that this body passed, and I would argue this House led on last session to deliver for our constituents. And so it fully funds House Bill 3. Representative Huberty, the teacher pay raise that we were talking about earlier, no reason that can't be maintained because this budget provides for it. So in addition, for higher education, $110 million for Texas grants. That's huge. That is going to open up the doors of higher education to so many families in our state that would not have otherwise have had access. And that is important anytime. It is especially important now as we emerge from this pandemic and we have to ensure that people have access to college more than ever. And finally, $380 million to fund enrollment growth at general academic institutions and health-related institutions. $380 million for enrollment growth in higher education. That wasn't there a week ago. And I sincerely thank Chairman Bonin for listening on that and for all who led to make that happen. That is a significant win for higher education and sorely needed for higher education. So for those reasons, I look forward to casting an aye vote on this budget, and I encourage you to do as well. Thank you.